Data privacy is everything in this day and age. My name is Royce, and this is my partner Nessa,
Hi guys,
and we're both software developers and UI designers who, like to paint in their spare time.
and we're here to introduce an adaptable, easy to use, user friendly web portal that ensures what medical data can be viewed or blocked to ensure the user's privacy.
We design our app to be user centric. The patient and their data is the main actor of the system, with the medical staff receiving only what the patient allows them to see. This kind of patient consent system has a global impact.
Every patient has things they want to keep to themselves, but how can they be so sure that that will be the case? Users currently do not have a way to pick or choose what medical information they consent to share.
And we want to address this issue through our patient consent system, CONTIENT.
So let's set a scenario for a typical patient. Let's call her Jane, a 60-year-old who wants to go for a general checkup but doesn't want to share her entire medical record with her GP.
All right, let's see how Jane would go about protecting her privacy with CONTIENT. She would input her health card number, her password, and sign in. She'd be faced with an acknowledgement saying that, she's about to access sensitive information. And here's the main screen. This is where she would fill out all her information and check mark the ones that she's okay with sharing. So, for example, if she did not want to share immunizations, she can uncheck the all and it would uncheck all or recheck it. Uh, Same goes for this one. But maybe she does want to share that she had pneumonia and hypertension, but she doesn't want to share that she has diabetes or a cesarean section. Let me just save and let's go into the terms and conditions page. So for the terms and conditions, this, we're dealing with a lot of patient sensitive information, and thus we would need some form of terms and conditions, like so. As for the help, ideally, Jane would be doing this from her own house. And from there, maybe she doesn't understand how things work. And that's why we would have a help page to clarify on anything that we possibly can. For the history, this is where we utilize the blockchain technology, the immutable trustworthiness of the ledger and history of that chain, to identify that, for viewing history and update history. Here we have the date, the who viewed it, their title, and then if they chose to view everything regardless of what she put forth. In the update history, you would have the date and the information that she changed on that day. So the overview is kind of essentially what the doctor would see if they were to access her information. All this information is what she chose to share. So let's sign out. And just like that, the doctors can only see what Jane wants them to see. That is, unless a life-threatening situation calls for all the information to be revealed.
Thank you so much, Royce, for the demo. Jane's privacy is now safe through the help of consent. We
Mhm.
know Jane would definitely want this, but why would a hospital adopt this?
We know our target buyers are healthcare organizations. The reason they would want something like this is because we expect a high return on investment, because it saves costs by avoiding unnecessary in-person visits and lengthy administration time, both of which can slow down this whole system. That's not something you want to learn the hard way.
But what about us? What did we learn?
Uh, I would say that we learn the strengths and applications of blockchain, especially in regards to providing a trustworthy ledger for accountability when dealing with accessing sensitive patient data.
I would agree that blockchain is truly takes our privacy accountability to the next level.
Mhm. It's the ease of use, the ease of adoption, and security what make a patient consent system like Conscient a must for modern healthcare organizations. Thank you.